Welcome to the MS-Perspektive podcast, Perspective with a K as I'm German. I'm Nele von Horsten, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com you will find the show notes, 11 free tips as a PDF and lots of other information. And now the show begins. Thanks for tuning in again and welcome to episode number 125, the MS Brain Health Strategy, Treatments, Cognitive Tools and Patient Empowerment with Professor Barbara Willekens. And now enjoy the interview. Hello, Barbara. It's such a pleasure to have you on the show and hello to Antwerpen.
Yes, it's such an honor to be on your show and to be able to talk to an international audience in this podcast. I'm very happy to be here.
Yes, thanks for taking your time. And before we actually start with the interview, it would be lovely if you could introduce yourself to the audience so they know who is with me on the podcast today and what your involvement in MS care or research is.
Okay, so I am a neurologist by training, and I work at the Antwerp University Hospital in Antwerp in Belgium for more than 15 years now. I've been involved in care for people with MS and also in research. We provide dedicated consultations for people with MS. I don't work alone here as an MS neurologist. I have two full-time colleagues who are also working together with me. We have a dedicated MS nurse, and a consultant. We have the possibility to have multidisciplinary care with a social worker who helps with issues for which people are dealing with. Yeah, that's the clinical part, I would say. We have a big MS center. We get tertiary referrals. And for the research part, I do clinical and translational research. We have focus on clinical trials, work also on novel treatment strategies, cell-based therapies, but also repurposing of drugs. And we're doing a big clinical trial at the moment with metformin in people with progressive MS. So that's a short introduction of what we do and who I am. And I'm looking forward to the interview questions.
Yes, fantastic. And it's quite a lot you are doing, which is great for our community. So today we want to talk about brain health. For those unfamiliar, what does brain health actually mean and why is it so important for people with MS?
Okay, so brain health is actually a general topic that means that you try to have a brain that functions as well as possible in all kinds of domains. In a psychological way, but that it also functions good in motor, sensory symptoms, that you have a societal role, so that it can get its full function that it's made for, actually. And I think it's also important to emphasize that brain health is not only important for healthy people, but it's very important for everyone. And maybe even more, and especially if you have a brain disease, then still you can have brain health or try to strive to get brain health, because by doing this and by trying to live a brain healthy lifestyle, you may influence the course of your disease, and you may have a better functioning of your brain, even though there could be an underlying disease there.
Yeah, absolutely. And that's something I try to emphasize very often on my podcast. But you never know who is listening for the first time on the episode. So when we are talking about brain health strategy, what does this involve, and why was it important to bring together so many voices, or why is it important?
Yeah. Um, it's very important to bring many stakeholders together, because all stakeholders can have different viewpoints, and by adding different viewpoints to something which is so important for not only people with MS but for the whole team around the people with MS, um, you get like a 1+1 is 3 or 1+1 is 11 phenomenon, where you have actually a really good input on what it entails and what you can do to try to improve it and to make it better. I think when we talk about people with MS and brain health for them, because after all it's a podcast for people with MS we're in, so I would like to focus on that. Um, is that there are various topics that are important in brain health. One of them is try to preserve your brain in the best way you can. And you can do that by uh, trying to make new brain connections. And you can make new brain connections by engaging in social activities, by maybe taking new classes or learning something new, a new language, a new skill, doing a hobby, doing fine motor skills. Very relevant also is your lifestyle, trying to live a healthy lifestyle, um, eat healthy, sleep well, don't smoke, drink alcohol in a very limited way, since I think you also need to be able to, of course, have a nice life where you do are not where you are allowed to do things, but try to do it in a way that it's good for you and it remains good for you. Also, try to move. Even if you have disabilities, there are always ways where you can try to remain in move. Some people with MS may be excellent runners still. Some of them may even have a better condition than I have, I would say. Uh, but some people with MS who have more disabilities and have more difficulties with walking or who use a wheelchair, they can also still remain in move, because they can try to do arm movements or use additional like foot bicycles to have movement of the legs. And so I think for everyone there is something to do to improve the brain health and to try to maximize yeah the resilience of your brain for future attacks on the brain and for future lesions in the brain.
Yes, 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 absolutely. Uh, I stopped totally drinking alcohol when I got my diagnosis a few weeks later on, and I think it was a smart move. But of course, I do other things. I eat too often, probably sometimes chocolate or things like that.
Well,
Too much sugar, but there is
of
you have
course.
to value what is
Yes, and I
away.
think everybody has the right to have a little something which is maybe not completely fit to the brain health. Mm, because sometimes you need to, um, yeah, to be able to have a, how to call it, something that allows you to feel free
Yeah.
and to feel not too restricted by all those things that may sometimes feel like it's imposing a lot on you, because you need to do a lot for it. It asks a lot of people. It asks a lot of commitment and continuity. And that's not always easy. And that's why sometimes you need to be able to get off the road for just a little time, and then thereafter you get back on the road. I think that's important, always to try to be in the road, but be able to have a small detour sometimes.
Yes,
Yeah.
absolutely. And I think what you summarized before, I had the honor to talk about the COGEX study, which in a way failed, but on the other hand was very interesting that whatever you are doing, it helps you, and it helps you even when you are in a very progressive state. And it's important, the social interaction, moving, using your brain. And I will link it in the show notes, that interview with Mr. Feinstein. But very, very interesting. And I think it was not a failure, but a very important outcome of that study.
Yeah.
But yeah, coming back to another point, which I'm emphasizing very often here on the podcast, disease-modifying therapies. Why is it so important to start the early treatment to slow down the MS progression?
Yeah. We haven't touched upon that topic yet in the interview, but especially for people with MS who start off with an relapsing in an inflammatory disease course, it's very important to take disease-modifying therapies and to adhere to them. And what we know from many years of research now, and from big data coming from various large databases at the international level, also for instance MS based, but also large national registries from the Nordic countries, from France for instance, we see that starting treatments early and high efficacy treatments early is also protecting the brain from further damage in the future. And although it cannot completely stop MS in all patients, um, it really adds to providing additional resilience in the brain uh, and and reducing the the immune attacks in the brain, and reducing the damage done by those attacks that you may not notice when you are young, um, because then your brain is still very resilient, but that you will only start noticing when you get older, when your brain starts to get more stiff and is becoming less resilient and less adaptive, because that's unfortunately what happens when we get older. And it's of course that we want to limit the damage done in an early stage as much as possible to be better when you grow older.
Yes, not just having a nice life now for me, it's already the 40s, but
Yeah.
also, I don't know, my parents are now over 70 and they can enjoy life. And I would like to do the same, and hopefully most of the MS community. So that is very important. Are there nowadays tools or resources that help patients and doctors decide on the right DMT, so the right immunotherapy together?
Oh, very difficult question that is. There are some recent studies looking into immunophenotypes, but I would say that's still research based. And tools to look into it. There are some that look into it, but it's still more based on preference of patients rather than on a truly individualized strategy to know that this treatment is the best for this patient, because there may even be patients who are excellent responders to for instance, the old injectable therapies, pharmacogenomics studies. I think very recently one was published in JAMA, looking at pharmacogenomics and interferon beta responders. So, so I think even there it's possible, and there are also, of course, a lot of inter-individual differences in probably in regenerative capacity that we still don't completely understand, which makes it hard to provide a truly individualized strategy at the moment. So we are not there yet. There have been very big steps forward, but it's not at the stage like in cancer therapies where you have certain markers that say, okay, this type of cancer is best treated with this type of immunotherapy, or is a responder to this immunotherapy or not. We're not there yet in MS. And the main difficulty, I think, is that we don't have the tissue available to study it, and it is available in cancer, for instance. We will get there eventually, but it's a slower pace.
Yeah. And I think, but it's important to understand for the patient community that it's sometimes a little bit of a trial and error way, and we must go through this. For me, luckily, we found the right one at the beginning, and I'm one of these great responders to the old medication, cladribine acetate. It works for me fine, and I will not change it as long as it works fine. But I know I'm kind of a dinosaur.
We also have dinosaurs like you. It's that you call it dinosaur yourself, but of course there are, and the difficulty is, of course, that it's very difficult to predict in the beginning what will happen later with people with MS. We are still quite bad at it. Actually, we can predict who will probably not do so well, relatively okay, but it's very much more difficult to predict who will do well.
Yeah. Of course, if
that's
you have
something that we are not good at to predict from the beginning.
Yeah, of course. If there is lots of relapses in a short period, you are pretty sure this person needs a high-efficacy treatment.
Yes.
But you don't know if you would have seen me at the beginning now, you wouldn't know will I be doing good or not. Yes, of course. Back then there were not many choices, so in a way that's why it happened. So let's talk about comorbidities, because I haven't done that too often on the podcast yet. What are comorbidities and how can they affect the brain health, and what can patients do to manage their overall health?
Okay. So comorbidities are actually other diseases that can affect a person with MS. And well-known comorbidities are, for instance, high blood pressure or diabetes, or overweight or obesity, or depression and anxiety. Those are some of the comorbidities that you can see indeed in people with MS. Other people with MS may have an additional autoimmune disease like Crohn's disease or thyroid disorders. And of course, this is not limitative. There are many more, but I just want to give an example of some of these comorbidities that we can see. Sleep disorders are also, for instance, much more frequent in people with MS, like restless legs, or sometimes breathing disorders during sleep apnea symptoms. So we know that several of those comorbidities are associated with a worse disease course. So it seems logical that you try to target those comorbidities and to try to either avoid them or treat them well in order to be well, to be better in the course of time. And there again, those comorbidities are often very much interrelated with the concept of brain health. Since many of those comorbidities, you can try to tackle them in part with change of lifestyle. So it gives also some form of control, something you can do to try to live a healthier life.
We talked already about the lifestyle choices like eating healthy, not smoking or stopping to smoke, things like that. Are there any small changes that make a big difference?
If I had to choose one lifestyle change that would make the biggest impact, I think, in my opinion, it's stop smoking. Um, uh, Smoking is so bad for brain health in general, but also in MS, that stopping with smoking would be my top one thing that I would like to focus on. But of course, it's very difficult since it's an addiction, and for some people, it's very, very difficult to quit or to reduce smoking. Um, and we know that addictive behaviors are sometimes very difficult to change, even if there is a willingness. But it all starts with the motivation to change. If you are not motivated to do it, then it's definitely not going to work. So you need to be motivated first yourself that you really want to do it. And then you can take the next steps and find help and resources that can help you um, to stop this bad habit.
Yeah. And please, dear listener, if you want to have a deeper look into this or hearing into this, listen to the podcast with Claudia Mark. She herself smoked at a point, and she is doing a lot of research on MS and smoking. And she gave some very good examples and tips how to stop smoking. And I think that makes way more sense than getting these tips from me. I never touched a cigarette in my life, so I can't give any good advice. But she was a heavy smoker. She stopped, and she explained why you should take as much help as possible from your general practitioner and maybe a psychologist and so on. So please do that. And she is explaining what it makes with your MS in much detail. I will link that podcast as well. On your research, what do you know about the topic of memory and thinking problems? Because many people with MS are worried about that. And what can we do to protect or improve the cognitive function, especially?
Okay. I would say it's not my research topic of expertise, but of course I know something about it to help people in their daily life. So we know indeed that many people with MS complain of cognitive disorders, mainly being then, what is cognition? Cognition actually entails your thinking processes, your attention, the way you can find words, the way you solve problems. Um, and in people with MS, we often see that the attention is one of the first issues that they have difficulties with. There are also several comorbidities and associated symptoms that influence cognition. Um, Very much problems that we see are fatigue that influences a lot the cognition, and also sleep. So when someone and also depression and anxiety. So this is very much interrelated. So when somebody starts to complain about attention cognition, it's always um, a package of symptoms and potential issues that we start to explore to see, is there maybe a reason uh, for it? Is there something where we can also intervene and give additional tips and tricks to improve it? Um, and if all those additional symptoms have been looked at and tried to treat in the best way and manage in the best way possible, and people still remain and have these attention problems, what we always try to advise is try to take regular breaks. If you are doing tasks, don't keep doing them for hours and hours, but try to take a regular break. For instance, if you're listening to such a podcast, it shouldn't take 45 minutes or an hour because your attention span will be gone. If you want to listen to a long podcast, you could also choose to break it up in smaller pieces and listen to it in several pieces, since your attention may be better for shorter time frames. Also try to um, do difficult tasks and change them with more routine tasks, like try to make a diversity between them. Sometimes take a small break or a small nap or 5 minute nap, which can help you regain some energy. Uh, that's important. And I think it's also very important to remain cognitively active. I think work is very important for people who can still do it. So we always try to keep people at work as much as they can. If that's not feasible anymore, then it's important that people try to find a hobby or some other activities that they can engage in to keep their brains active, and to still to try learn new things. Simple things can also sometimes be helpful, like doing a game with your family or children if you have them, or grandchildren if you have them. It's also helpful doing Sudokus or other puzzles can be helpful. So there are many things that people can do to try to improve that, and to remain active.
Fantastic. And thank you for also giving some examples. Very helpful. For me, the shared decision making is also an important topic, which I have in various episodes every now and then. What does
Mhm.
shared decision making mean in MS care, and how can patients feel more confident when faced with the complex treatment choices that we have in our disease?
Okay, so indeed, it's important that you mention that the treatment choices are very complex, since we don't have the ideal marker, or I always try to explain, we don't have a finger prick test to say that this or this treatment will be best for you. So we will try to discuss it together, and so that you can make informed choices together with the team. So, in general, how we approach shared decision making. Shared decision means actually that the decision is shared between the healthcare team, which can be the MS neurologist, but also the GP can be involved, and the MS nurse can be involved, and the person who has MS, and also potentially his or her family members or friends or anyone around them. So that's actually the way we try to approach the shared decision. It's important to explain to people with MS in a way that they can understand best why treatment is important and which treatments there are, what their effects are, what their side effects are, because most of the time people with MS will not really feel the effects of the treatment in their daily life at a short time, uh, but they will feel the side effects of it. So that's very relevant for their quality of life. Since MS is a disease that affects young women at an age where they still want to have a family, it's also very important thing always that we say, okay, it's something to take into consideration as well. If you want to have a family at a short time, or is your family wish already complete? And so we try to explain everything, um, and then give people some thinking time about it to come back and ask questions, and then make a joint decision. And of course, not all people are the same. Some people really want to decide themselves and say, okay, I want to have this medication. But some people still say, doctor, you know best, please advise me. Um, and it's fine. It's all ways of shared decision making. Um, and yeah, the level of involvement is also decided, I would say, by the person who has MS.
Yeah, yeah, absolutely. And if dear listener, you want to know more about the family planning, there was an interview with Celia Orefa. Anyhow, I will link that on women in childbearing age and decisions you can make. And I have the German interview with Kerstin Helwig, but I think I haven't translated it into the English podcast. But there are people out there who have a deeper look into this and bring back the information to all other neurologists by conferences like the ACTRIMS. Another topic I want to talk about, global inequality. You are in the board of researchers for MSIF. Access to MS care is not equal around the world. I mean, you are living in Belgium, I'm living in Germany. We have very great healthcare system. But what are some of the challenges MS patients face depending on where they live?
Well, I would actually say Germany and Belgium may also be very different, because in Belgium we can also not freely prescribe any MS drug to any patient. So there are also limitations in what can be prescribed to whom, especially considering high-efficacy therapies. So, but of course, I mean, we have good access and we can treat patients. And if you go into countries in Africa, there it's very difficult. I mean, even getting diagnosed there is already a very difficult thing. People going to the doctor there, they only go when they are almost dying. I'm working together with a colleague in Uganda. And I mean, it's a completely different way of living, of course. Um, and healthcare systems are almost non-existent unless there are private healthcare. People need to pay out of pocket for all treatments, so that's a very difficult situation. But a very big important step that has been made, of course, is to put certain MS disease modifying therapies on an essential medicines list, since this is the WHO essential medicines list, where now for the first time in many years, certain MS disease modifying therapies were put into this list. And actually, this means that the importance of those therapies and the need for higher accessibility at a global level is really underscored in that way.
Yeah, and great achievement. So thank you to everybody who was involved in getting that done. But still, I think there's a long way to go. So what do you think? What can be done to help people in low or middle income countries to get the care they need?
Well, the main thing is first to I think go to the basics that they need. In some of these countries, it's even difficult to have good water and good food for everyone. Um, um, to have good facilities, to have good roads, to have enough healthcare workers in the country. There are countries where there are almost no neurologists. So there is a lot to be done regarding basic infrastructure that's needed for a society. So those societies need to grow at an economic level further, and that will also, of course, help them to be able to provide better social social security and social care and access to those treatments. Further, I think also industry should play a role in um, setting up studies and trials, giving people access to treatments in those countries. But of course, also for that, infrastructure is needed. So it's still a long route and a long way to go. Another thing, of course, if there are no healthcare workers who are specialized, it's difficult to get a diagnosis. if there are not enough MRI machines, or if there is no way of doing oligoclonal band testing in CSF. I mean, there's also steps being taken there. So education is a very important topic. Educate um, um, clinicians, educate nurses on how they could detect signs of multiple sclerosis. Uh, that's another thing that's needed to get more equity at the global level.
Hmm. Yep. Yep. Lots of things to be done, and yeah. But hopefully, we are moving forward. I'm reading National Geographic since more than 20 years, and even so, in the normal news, you see always a focus on bad things. In
Mm-hmm.
National Geographic, they are pointing out that a lot of progress has happened, and that makes me
Absolutely.
feel better. Even so, there's a
Absolutely.
long way to go, but still.
Absolutely. Especially if you look, for instance, into Northern African countries, they have made already a lot of progress in the past years, especially considering diagnosis and treatment of people with MS. Um, and that progress can definitely be also of help for the sub-Saharan and the countries in Africa, for instance, um, to learn from how that has improved.
Mhm. Yeah. Coming to the last topic of our interview today, digital tools and data. How can digital tools like health apps or wearable devices help track or improve brain health?
Oh, that's a really broad topic you are touching upon now.
Sorry
And
for that.
yeah, digital tools. I would say the first thing is that you need to like to use it in a continuous fashion. Because if you don't use them continuously, then yeah, it's not going to be of much help or much value. There are, of course, various digital tools that you can use on your smartphone. For instance, your step counter on your smartphone, although it may not be completely reliable, it does give you some kind of an indication of how active you have been. So that could be something you could track. There are various apps available that can be used by people with MS that are more MS specific, where you can track your symptoms and have a bit of an idea how those evolve over time. Um, I think in the future, probably more passive monitoring will be more helpful, since with many of the current tools, you need to be active and put in data yourself and be confronted. And then after some time, you may get tired of filling out all these things. So in that way, passive monitoring with wearables may be more future proof. Than the classical apps. Although apps can still be helpful and useful if they would send you reminders, for instance, reminders on when to take your medication, reminders on when you need to have your new appointment with a neurologist, or when your appointment is. So there are many tools, but I think the danger of all those tools is that you could have too many, and if you are using too many, then you will probably not use any of them in a good way. So I would say if you like to use those types of tools, try to limit yourself to a couple of them, but not too many, and try to then remain engaged with that specific tool
Yeah, yeah.
to
Yeah,
track it over a longer time.
that's a good tip. And yeah, with the passive in the background, I think that would be very smart, because at one point, I guess the wearables will be able to check if I'm going by bike or if I'm swimming or if I'm walking, because I start to forget to say, okay, I started now to walk. I just walk. And that's important for me to walk and not to start the app. But then I have a cognitive training app, Neuronation. I don't know if it's international available. It's a German one, and
Mhm.
I bought a lifelong setting 15 years ago or so, and I train it for months every day. and then I stop it for a few weeks. But maybe because I was aware of that we are having the interview today, I was starting it yesterday, and of course I was a little bit below my average, so I had to do certain trainings 3-4 times to come back to the level where I was, and but it felt good, and it's a funny way of training your cognitive function, memory, and doing two things together, dual task mode and things like that. So it can be good if you find an app which you like. It can be really fun nowadays.
Yeah.
Okay, so let's come to the quickfire Q&A. Complete the sentence. For me, multiple sclerosis is
A lifelong disease you live with, but that does not need to define your life.
Yeah, very good. What development would you like to see in the field of multiple sclerosis in the next 5 years?
I would like a very high efficacy therapy for regeneration of nervous tissue and myelin in MS. It's very high aim, but that's an evolution I would really like to see in the coming 5 years, that we make very big steps there, in a similar way that big steps have been made with high efficacy therapies for relapse treatment.
Sounds very good. And I start to look a bit more into clinical trials, and I just finalized my master's program in multiple sclerosis management, which is more or less aimed on neurologists. And I will finalize in October my UPATI program, where you can be involved in clinical trials as a patient expert. So I will dive deeper a little bit in that topic. And I think there are some studies already out there, and probably there will be more to come. And it's very interesting. And yes, fingers crossed that this will happen in the next 5 years. And based on the Charcot Foundation Young Investigators, I had already some interviews with young researchers who are doing great work, and I think lots of things are happening there. So yeah.
Absolutely. There will be many things to look out for, and I believe definitely that big steps will be made. Maybe not yet to be applicable to everyone with MS, but I'm sure big steps will be made between now and 5 years.
Yeah. So, what's the final message you would like to send out to our audience?
Considering brain health, or in general?
You can choose.
I can choose. Okay. A difficult question, since there are so many messages to give. But let me think about the final message. Being diagnosed with MS today is completely different than 20 years ago, and every day important steps forward are being made. So remain in contact with your MS team always, and try to follow their advices in the best way you can, since this will help you to live the most healthy life you can with MS.
Yeah, that's a good one. A good summary. Barbara, how and where can interested people follow your research activities?
They can follow me on LinkedIn. I have a quite active profile there. They can also just Google me and look me up at the website of the Antwerp University and the Antwerp University Hospital. And for those who may have a more research background, they could, of course, also look into PubMed, where all publications are being stored. I have a Twitter account, but must say that I'm less active since Elon Musk made X of it and took over. So LinkedIn would be potentially a good way to follow it, since I post updates on it.
Fantastic, great. Yeah, I actually stopped on Twitter since Elon Musk. It demotivated me too much. I stay now with Instagram, with LinkedIn, with Facebook indirectly, and a little bit of Pinterest, and publish the podcast to YouTube as well. But yeah. Anyhow, and I will, of course, link all your social media presence in the show notes and on the blog article. Thank you very much for giving that broad overview. I love to have every now and then a quite broad overview, and with other episodes, I'm diving more into the details. But it was very great, and I hopefully will see you, probably not this ECTRIMS, maybe next ECTRIMS. But yeah, somewhere around one of these conferences. And thank you very much for all your work you are doing for the MS community.
Hey, thank you for the opportunity to talk. I really enjoyed it, and maybe we will talk again in the future when I have some results to share about
Fantastic
research.
Would love to do that. Thank you very much. Bye-bye. I hope you enjoyed the interview, learned something new, and got inspired that brain health is something very relevant for us, and that we can work on a healthy brain despite having multiple sclerosis. So please recommend the podcast to whoever might be interested in this. Stay as healthy and positive as possible, and see you next time. Bye. Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts, which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. See you next time.